Patrice told me it was very important to the group that I talk about conditions associated with syringomyelia because that's why a lot of you come to the conference. So if you have any questions, as I said, I have like 13 slides, so I should have plenty of time. All right, well, one condition associated with Chiari is syringomyelia. It's about 1 out of 10,000 patients, and usually occurs in middle age or early, 20 to 50. Sometimes occurs in children, but it's a congenital lesion, and it's always been a question, why? Why now? Why would it develop most often at 20 to 50? Associated with the Chiari is basilar invagination, and that's, we can talk about that. And then some people have lesions not at the craniocervical junction, but in the spine, and about 12% of the people have that. And then there are other people who have intramedullary tumors or what's called myelitis, which is from multiple sclerosis. All right, so when we talk about, I don't really have the laser here, I should have thought ahead, I guess, but well, that's not the way to go. As you can see here, that's a cyst in the spinal canal, and there's a, oh, here we go. Here we go. Okay, I'm trainable. All right, so here's the spinal cord, here's a cyst, here's the spinal cord below, and that's what's called an arachnoid cyst. And this was a man, he worked in construction, and he had this cyst, it pressed on the spinal cord, and he developed syringomyelia. So the underlying condition, this cyst, blocked the spinal fluid flow and caused the syrinx to form. So after taking out the cyst, the syrinx went away. So it's very important to know what's the primary condition, what's the secondary condition. The primary condition is what caused something to occur. So in this case, even though he came down to see me and he says, look, I want you to put a tube in my syrinx, I said, well, it's probably better to take away the thing that made the syrinx grow in the first place rather than treat what was the result of this thing pressing on the spinal cord. Because if you just put a tube in the syrinx, then you drain the syrinx, but you still have something pressing on the spinal cord, which can be a problem in and of itself. All right, Dr. Batzdorf is an expert in syringomyelia and Chiari, and he came up with this algorithm. But anyways, you have this problem, a Chiari and syrinx, and the hindbrain is, these are the symptoms related to the Chiari, these are the symptoms related to the spinal problems like the syrinx. And so you just follow this down. If you have local pressure from your Chiari, that presses on the dura, which is the substance around, the membrane around your Chiari, and that gives